Hey there, I'm Dr. Eric Watson. I'm a rehabilitation neuropsychologist. I look at how people's brains work and how our thinking abilities change over time and how different things affect what we do and what we think. COVID and long COVID, or the symptoms that persist well beyond a COVID infection, they start to affect the way that we think. So, this can be affecting our concentration, how fast we take in information, and even affect our memory and our language abilities as well. Yeah, so brain fog is as foggy as the term that we use to describe it. It's really just a constellation of symptoms that people describe feeling cloudy or foggy in their thinking. But a lot of times it has something to do with attention and memory. So oftentimes it's an inability to concentrate or just feeling like you're losing part of your memory, having a hard time recalling details and forgetting where things are. From the research, what we're learning so far is that there are at least three main potential causes of long COVID brain fog. The first is inflammation. So essentially, this is when the viral infection prompts an inflammatory process throughout the body. And in this case, it's in the brain. And what happens with neuroinflammation or inflammation of the brain, there's a decrease in the signaling, which can cause some of that inattention, difficulties with memory, and some of those other thinking problems. A second mechanism that we're learning about is how it affects our vascular or our veins and arteries and capillaries in our brain. So the blood supply, really. COVID-19 can contribute to vascular inflammation. So kind of leading into the whole inflammation idea, but more at this vascular level. And in this case, it affects the blood flow to the brain. And then lastly, the third mechanism that we're studying is our autoimmune response. So this is when our body is fighting off infection. And unfortunately, what happens is with an autoimmune response is it's a faulty immune activation triggered by the presence of some antibodies. And so essentially our brains might be trying to clear out this infection, but it's kind of attacking itself and causing a little bit of damage in the process. At the present moment, there isn't a specific treatment that targets brain fog. But one thing that we do know is that living a lifestyle that promotes a healthy brain is really what's most important. And so, something here that we follow is the 6 pillars of health. And the 6 pillars of health are 6 key areas of brain health promote better thinking. And each area delves into something that you can do in your everyday life to help promote brain health. The first pillar of brain health is just managing your medical health. So, one thing we do know is that we have a mind body connection. What we do for our bodies is good for our minds. And so, oftentimes, this is the first step, which is just consulting with your doctor and getting under control any outstanding health conditions that might need to be better managed. And this could be things like hypertension, diabetes, or even just adhering to taking your medications. So, that's usually the first step, which is just taking care of your health. The second pillar that we focus on is physical activity. And oftentimes when people hear this term, they get turned off a little bit because they think they have to go run a marathon. But essentially what we want people to do is just stay active. This can be taking walks. It could be doing some jumping jacks in between meetings. It's really just anything to kind of get the body moving and get active as much as you can. And just keep this in mind that anything is better than nothing. The third pillar that we promote for brain health is food and nutrition. You've probably heard the expression, you are what you eat. And there is some truth behind that. We really do take in all the vitamins and nutrients of everything that we eat. And when we eat well, we can function well from a cognitive perspective too. The fourth pillar is related to sleep quality and relaxation. Better sleep is related to better cognitive functioning. And so when you can get really good sleep, you'll have improved thinking and improved mood as well. And so oftentimes relaxation helps with sleep. So when you can practice your relaxation, you can promote getting better sleep at night as well. The fifth pillar is cognitive fitness. Just as one should be physically active, one should stay cognitively active too. And this could be anything that you enjoy. It can be learning a new language. It could be trying a new hobby or activity. It could be doing things that you've already do to keep active. And last but not least, social interacting or connecting with others is the sixth pillar of health. Oftentimes, the social interaction lends itself to all of the other pillars. When we interact with people, we might be physically active, cognitively active, eating a really well-balanced good meal with people and friends. And so just staying socially active is another way to keep your brain happy and healthy. My two favorite resources are, the first is the Cleveland Clinic. You can Google the 6 pillars of brain health and it'll take you directly to their website. What you can find there are the 6 pillars, and you can click and interact with each of the pillars to learn more about medical health, physical activity, quality sleep. You can learn a lot more about each of the pillars and get some suggestions that could be helpful for you. The second resource is the Brain Injury Research Center. It's my home. It's where I work as a rehabilitation neuropsychologist. Here, what you can do is you can schedule an initial consultation where we can walk you through the process of learning more about your brain health and your cognitive functioning. From those steps, we can target each of the areas that you might be having trouble with the rehabilitation program. So this is a more individualized program that can be developed in collaboration with what exactly you need.